This voiceover is going to go over just 2 or 3 disorders of the musculoskeletal system that I did want you to just be aware of, but didn't want to use class time to spend too much time on them. So the first disease process is achondroplasia. And achondroplasia is also basically known as the primary cause of dwarfism. It's a genetic condition that results in an adult height defined as anything less than 58 inches in height. Infants and children with achondroplasia, their head and torso are approximately the normal size, but their long bones don't grow the same, and that causes short arms and legs. So in terms of a clinical manifestation, those short arms and legs, their fingers are short, they have a large, very prominent forehead, and hydrocephalus is sometimes present for that, so they sometimes need to have treatment for that. Achondroplasia itself does not have a treatment. It is basically a process of supporting and managing these children. Some do undergo some limb lengthening procedures that can be done to try to increase arm and leg length. And some will need that shunt for hydrocephalus. But overall, this is not a condition for which there is a treatment. So some other disorders that I want to touch on. Osteoporosis and osteopenia. Now, those 2 disease processes we often think of in the adult world. However, that can be noted in children. So osteoporosis is a decreased density and mass of the bone, and that just makes one more at risk of fractures. So osteoporosis is something that we often associate with postmenopausal women. But in children, it is related to an imbalance of nutrition or a pathological condition of some sort. So these are the following ways in which children and infants can get osteoporosis. First of all, in the premature infant, they often have osteopenia of prematurity. And that's due to the fact that bone mass is not usually acquired until the later weeks of pregnancy. And so in those latter time frames, the infant is already born, and so they are born with weaker and less developed bones. They may also not be able to ingest nutrients that will meet the metabolic needs for their bone growth, and they are much less active. And we do know that activity and weight bearing are a factor that is known to decrease bone mass. As far as children go, they have diseases that are associated with a decreased mechanical use of those bones. So no weight-bearing types of activities or limited weight-bearing, or they have no use of their extremities, and that can lead to osteoporosis, osteopenia first, and then osteoporosis. Some examples of that would be children with spina bifida or cerebral palsy. Treatment for osteoporosis and osteopenia, well, first of all, let me back up. We do treat children with cerebral palsy and spina bifida and whatnot. We've talked about the fact that we treat them with braces and wheelchairs and castings, etc., and that will cause a weakening and an osteopenia to develop, which eventually will lead to osteoporosis. Often we do not know that a child has osteoporosis until we see a fracture, unfortunately. But with regards to treatment, good nutritional management is incredibly important. And so what we'll do in infants is make sure the breast milk is fortified with nutrients that the kids need, and we give premature formula to premature infants. So it's specially designed for the premature infant to provide the nutrients they need to assist with growth and development of all of their body systems. We're also finding that good range of motion can promote weight gain and bone mineralization in a premature infant as well. So we are doing more and more of that practice. Finally, I just want to touch on a disease called osteogenesis imperfecta. This is a genetic connective tissue disorder that affects the bones. It's also known as brittle bone disease. These infants are born with very fragile bones that are very easily fracture. So they can fracture during the birthing process, they can fracture if they are picked up incorrectly, they can fracture if we wrap them too tightly. It's a rather devastating disorder. There is an underlying disorder that's believed to be a biochemical defect in the production of collagen, and that particular underlying disorder is genetically transmitted. So what we'll see in these kids are multiple and frequent fractures and brittle bones. You'll notice that picture down on the bottom right, the sclera is blue. That is a classic sign. Their skin is very thin, and soft. They have altered joint flexibility as a result of things. Their muscles are very weak, and they do have short stature as a standard. You can look at those pictures of those infants that I have on the slide there, and you'll see. It is a very sad disorder. I have seen this disorder twice in my career, and it has been devastating. We've had infants with casting right off the bat, and as you can imagine, with fractures and broken bones, pain is associated with that. So this is very tough for how we handle these infants, and a lifelong concern and life limiting in terms of its prognosis.